About 2 years ago, I guess, maybe. I don't remember the exact date. We had a total of 9 sentinel events in our hospital.
Wow.
With retained foreign bodies. And most of them were Raytec sponges. A good portion of them occurred in labor and delivery, a few in ambulatory surgery, a few here in the main OR. And on all of those cases, the counts were recorded as correct. And so we knew for us that we had a clear issue. We looked at a couple different options that were out there on the market. I think SurgiCount was the name of one of them. Things where you actually had to line the sponge up with a beam to be counted, and we knew that that kind of system wasn't going to work for us because we don't have the time, especially on traumas or transplants, we're using a lot of sponges to be able to do this. So when the RF surgical sponges came along, it was like you don't have to scan anything, ahead of time. You count like you normally count, you bag like you normally would bag, and those kinds of things. We knew it was something we were really interested in, and so we started using those. Since that time, we have not had one single retained foreign body. We've had a couple of close calls, but those were detected with the wand. In those particular cases, the count was documented as incorrect. They knew they were missing the sponge, but when they wanded, they actually found the sponge. So it's worked incredibly well across the board. That we don't use any Raytec sponge without the RF chip in it. And like I said, since that time, we have not had any sentinel events. We've had no retained foreign bodies.
Nice.
We've used occasional when we know the count's incorrect and you're doing everything with tearing the room apart looking for your sponge and going through the trash. We've used the wand as like a Geiger counter, and it's helped us find something in the trash can, or that maybe something that had fallen under the bed or been kicked under the bed.
Does it seem to help you resolve it faster?
I think so. And the nicest thing was it didn't change our practice, and we're never going to change our practice, and that we're always going to count.
Right.
So that part is not going to change, but this just enhances our practice. For me personally, I understand the cost factor. I know a lot of hospitals are looking at cost, but our thought's always been, you have one lawsuit, and that pretty much kind of counterbalances what you're paying for the extra cost for the sponges. It's worked well for us. We knew we needed something that would be simple, something that would be easy to use, and that's why I think this particular system has worked. The biggest thing for us has been because it's so easy to make a mistake, and you don't think you could. How hard is it to count to 5, or how hard is it to count to 10? And so you don't think you would ever make a mistake, but that split-second distraction, the phone's ringing, somebody's pager's going off, you've gone to do something, and then you come back and you lose track of where you were in your count. And so it's very easy to put 4 sponges in a bag instead of 5, those kinds of things. So that's been the biggest impact. Seeing healthcare going today with a lot of the safety measures and status checks or timeouts or the World Health Organization checklist, I think that the whole culture is changing. And if there's something out there that can enhance safety, why would you not want to, or enhance your practice to promote safety, why would you not want to